The Department of Medical Imaging at Ann and Robert H. Lurie Children's Hospital of Chicago is home to more than 24 radiologists who perform approximately 150,000 examinations each year while providing 24/7 in-house attending coverage. The department is organized by divisions, including body imaging, neuroimaging, and interventional radiology. The body division is comprised of both modality-based and body system-based sections to create focused expertise in general X-ray, fluoroscopy, ultrasound, nuclear medicine, body CT and MRI, cardiac, fetal, and musculoskeletal imaging. The neuroimaging division offers subspecialty expertise in neurovascular, epilepsy, brain tumor, head and neck, and functional imaging. The interventional team performs minimally invasive procedures, provides novel therapies such as radiofrequency ablation and cryotherapy, and treats conditions including vascular malformations and stroke. As a whole, we host many clinical conferences with active participation from our referring physicians. Medical imaging has a robust multidisciplinary clinical and translational research program with over $250,000 in funded research and departmental research coordinator support. Come take a look at our department.
Hi, I'm here in the cardiac reading room. As you can see, we have windows, which is great, and we're attached to our awesome 3D lab. I'm just reading a cardiac MRI on a teenager with a dilated aorta. It's super great to work here because we get to work in conjunction with cardiology on our busy service. We also get access to all the newest fun tools, including 4D flow and non-contrast techniques. As radiologists, we don't have to spend all of our time in the reading room. Here we are in CT. At Lurie, we really focus on minimizing exam time and radiation dose so that we get the best images for the patient. As you can see, we decorate our rooms in super fun ways to make the experience as enjoyable for the kid as possible.
The Neuroradiology Division at Lurie Children's provides exposure to all aspects of pediatric neuroimaging, from brain tumors to epilepsy to spine imaging and head and neck pathologies. We have wonderful collaborative relationships with our clinical colleagues, and we balance our busy clinical service with education and research.
In neuroradiology here at Lurie Children's, we perform the full spectrum of advanced neuroimaging techniques, including PET, MR spectroscopy, functional imaging, and MR perfusion. Trainee education focuses on one-to-one attending to trainee readouts, as well as inclusion in subspecialty multidisciplinary conferences, as well as a dedicated fellow lecture series.
We're standing in one of our 3 IR suites. We have this biplane room and 2 single plane rooms. Every day we're staffed by at least 2 physicians and 1 advanced practice nurse, and we perform a wide variety of both neuro and body IR cases. On any day, we can be doing general things such as abscess drains and joint injections, but we can also get into things like lymphatic embolizations, arteriovenous malformation cases. So we do have a really great case variety, and we'll look forward to hosting you during your time at Lurie.
At Lurie Children's Hospital, our fellow trainees are exposed to a wide variety of ultrasound imaging techniques, including advanced liver elastography and fetal imaging for high-risk patients. Our fellows also learn how to perform contrast-enhanced urosonography studies, commonly referred to as CVIS, during the course of their training. CVIS uses microbubble contrast material, which is suspended in saline, and this mixture is infused into the bladder during the course of the examination. Ultrasound imaging of the kidneys allows detection of reflux in a radiation-free manner.
Hi, we're here in the main reading room at Lurie Children's, and I'm going to show you some advanced musculoskeletal ultrasound techniques. This is a longitudinal ultrasound image of the elbow in a teenage patient with anterior elbow pain, and we're showing that you can actually see the biceps tendon as it's coursing across the elbow joint and into its insertion on the radial tuberosity. The biceps tendon is intact, but is a little bit thickened, and so I told the patient that she probably has a little bit of biceps tendinosis, and that's probably why she has some pain.
Here we are in the fellow office. I'm somebody who's from out of state and have felt so welcomed by everybody here. Staff have been amazing and approachable and go out of their way to teach and show interesting cases, and even go so far as to share their phone numbers if we have questions or have concerns. So far felt very welcomed and felt like this is home for me.
The learning experience here in fellowship has been really wonderful so far. There's definitely a great mix of bread and butter pediatric radiology cases, as well as some really interesting pathology you won't find many other places. There are really wonderful resident and fellowship conferences almost every day, and lots of interdisciplinary conferences as well.
Thanks for your interest in our Pediatric Radiology Fellowship Program. Our one-year fellowship is accredited through the ACGME and affiliated with McGaw Medical Center at Northwestern University. All of our training is done at Lurie Children's in downtown Chicago, which is located on the campus of Northwestern University's Feinberg School of Medicine, within walking distance of many of the city's famous shopping and cultural attractions, as well as our beautiful lakefront. Our fellows learn through experience in different weekly rotations in all general and subspecialty areas of our department. There are also 6 weeks of elective time, designed for a deeper focus on one's areas of interest. Our fellows work either day, evening, or night shifts without separate call from home. Other ways our fellows learn are through one-on-one teaching by our faculty, dedicated weekly fellow conferences, and working with a mentor on a scholarly project. We have an educational curriculum and recently began using Google Classroom and exploring some new ways to unite technology with education. We also have additional 1-year advanced pediatric subspecialty fellowships in neuroradiology and cardiac imaging. I think this is a great place to work, with a collaborative culture and a good balance of research, education, and clinical excellence. You will receive good, solid training in pediatric radiology and the subspecialty areas, and mentorship by a diverse faculty with an emphasis on teaching, professionalism, and wellness. If you are interested in applying, I encourage you to go to our website for an application and further details. I hope you will join us.